was another casual day at Case Western Reserve University. I had just finished taking my chemistry midterm and walked out with the utmost confidence that I had just failed. Now, everyone has different ways of dealing with failure, but for me, that has historically always meant ice cream. So a couple of friends and I walked down to Mitchell's Ice Cream, but on the way there, a woman came up to us and stopped us and said, "My mother just died of cancer, and all the money I had, right down to every single penny in my pocket, had been spent on her healthcare bills. Now I don't have enough money to catch a bus back home and feed my children. Do you happen to have $20? Now we gave her the $20, but the first thing that flashed across my mind as I reached for my purse were the reasons I came to Case. I chose Case because it is a leader in biomedical research. I chose Case because it is surrounded by world-class hospitals offering top-notch care. Now, as a prospective biomedical engineer at the time, this enticed me, and rightfully so. But as soon as I came to Cleveland, I quickly realized that this top-notch care wasn't accessible to everyone. The fruits of all this research weren't necessarily accessible to everyone. Now, it doesn't take a humanitarian to admit that it shouldn't be like this, especially not in a country that invests more per capita into healthcare than any other country on the face of the planet. So I got a bit curious and started to do some research as to why this is the case. And turns out there are 4 primary reasons, in addition to a couple others, as to why the United States healthcare system is so expensive. The first one is obvious. Healthcare, while more expensive today, is better than it's ever been in the history of mankind. Now, as a consequence, people are living longer. In fact, by 2031, it is estimated that nearly 75 million people will be above the age of 65, a full 2 times larger than the 2008 number of 39 million. Now, it goes without saying that this would not only mean a higher demand for healthcare, but specifically more expensive care, thus leading to the already ballooning national debt to fit the bill. The second one is defensive medicine. Now, it's no secret that no hospital or doctor wants to be sued for missing a diagnosis or a misdiagnosis. This is why doctors often prescribe tests and scans and sometimes even drugs that are not always clinically necessary. In fact, one survey has found that nearly 91% of all practicing physicians practice defensive medicine, thus leading to an excess of $45 billion being spent on the sole basis of preventing malpractice liabilities alone. The third one is administrative costs. Now, it's a known truth that the American healthcare system is complicated. There are a variety of insurances: private insurance, employer-based insurance, Medicaid, Medicare, all with different enrollment plans, all with different things that they cover, all with different tiers of coverage within each plan. And that's only the tip of the iceberg. Now, this has led America to spend nearly 8% of all of its healthcare dollars on administrative costs alone, compared to the 1 to 3% that most other countries spend. And last but not least is drug prices. Now, I left drug prices for last because it contributes in a very significant amount to the rising expenses in the healthcare industry, but specifically, I left it for last because I also had a personal story to share regarding increasing drug prices. It was the summer of the senior year of high school. I had an incredible opportunity to work at one of the country's leading biotech companies. But more importantly, I had a chance to sit down with one of the company's C-suite executives and co-founder. Well, the first thing that was on my mind as we sat down was why drug prices are so high today and show no signs of slowing down in the future. And he had a very simple answer. He said that pharmaceutical companies like his spend hundreds of millions, if not billions of dollars, and a lot of time and effort and labor to discover a drug and move it to market. Once it gets to market, they're not only trying to recuperate all the money that they put in, but also make enough money on top of that to spend more on R&D and discover the next set of novel drugs. Now, admittedly, this view is contentious, but it's also undeniable that there is some truth behind it, especially because every year we have 40 to 50 novel drugs discovered. Now, nearly half of those 40 to 50 drugs are improvements of already existing drugs. The vast majority of the rest are novel drugs, yes, but for rare diseases. This means that there are 1, 2, or 3 in a good year that are blockbuster, groundbreaking drugs for common disease that people suffer from. Now, these drugs are game changers, but oftentimes are the product of intensive research, decades of intensive research, large amounts of labor and capital. Okay, so we have our 4 primary problems in addition to the couple of others that form the behemoth known as the United States healthcare system. So what do we do about it? Well, in terms of drug pricing, I'm incredibly optimistic, especially because CEOs and healthcare professionals all seem to agree that if we can utilize the novel technologies of the day, such as AI and and immunotherapy and nanotechnology and CRISPR, and make that drug discovery process just a little bit more efficient, just a little bit less expensive, and turn those 1 to 2 novel blockbuster drugs that we'll come out with every year to just even 3 or 4, it could revolutionize the healthcare industry. So there's certainly a lot to be optimistic about in terms of drug discovery and drug delivery and drug pricing. But when it comes to the other 3 problems that we talked about, such as administrative costs and defensive medicine and the aging population, rapid innovations in technology offer less immediate solutions, thus forcing us to consider the alternative: government intervention, regulation, perhaps. But I won't talk about that for 2 reasons. One, I have no idea how regulation or government policy works. And I don't want to start digging into that trench, especially because it's probably even more complicated than our healthcare system. And 2, even if we were to come up with such a magical policy that could fix our healthcare system, it wouldn't necessarily mean much if we don't change the mindset with which we approach healthcare. And that represents the primary reason why I'm giving this talk today. Because we are the next generation of scientists and doctors and engineers and policymakers and economists. So if change is going to start, it's going to have to start with us. We have to be the ones that are more cognizant of how much we're spending in our laboratories. We have to be more cognizant of the amount of scans and tests we're writing up for a patient with regards to their financial backing. We have to stop putting treating the patient above them being able to live a quality life after they walk out of the hospital. We have to understand that there's a fine line between spending and overspending, and identifying that line might give us the answers that we seek in fixing our healthcare system. Thank you.